Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. The topic for today is epidural steroid injections and sciatica. What I wanted to do is talk about some recent research that came out which shows on both sides of the equation the effectiveness of epidural injections. Let's take a step back though and discuss what exactly is sciatica. Well, there are two sciatic nerves in the body, on the right side and the left side, but what comes out of the spine to form the sciatic nerve is actually multiple nerve roots. So you have a few lumbar nerve roots and the first sciatic nerve root, so they come off the spine and then they join up and they form the sciatic nerve. The sciatic nerve is not small, it's big, okay? And it comes down through your buttock area and then down your leg. But if you have a disc herniation that pushes on one of those nerve roots, it can cause sciatica. So I did a little visual aid here. This is a disc, all right, and we're looking down on it. There's one at every level of the lumbar spine, and they basically are named for the levels that they connect. So if it's L4 to L5, it's called the L4-L5 disc space, okay? I liken it to a jellied donut, and I get hungry every time I talk about this, but the disc is like a jelly donut. You have the jelly in the center and then the covering on the outside. If there's a tear in the covering, and right now this is happening to 1% of the US population is having sciatica, and so it's very common. That's over 3 million people, by the way. The disc is coming out and it's pushing potentially on a nerve root. There may be plenty of disc herniations that don't cause any problems or symptoms because they're not pushing on a nerve root. But if they do push on a nerve root, that can lead to sciatica from the inflammation that it produces. Just having a disc push on a nerve root, so having this happening, is not necessarily going to cause any symptoms. But if it causes inflammation, and that's often the case, it can spark up pain of sciatica. Okay? So the question is what to do about it. Well, you can try Tylenol, anti-inflammatories, physical therapy, chiropractic, spinal decompression therapy can work well. You have that at the center. So all of those are an option. But as far as the realm of pain management injections go, this tried and true gold standard is epidural steroid injections. Those have been shown to work well over 75% of the time. And what I wanted to mention was the recent research in football players that showed 89% of them were able to get relief non-operatively and get back to playing pro football within a few months. So epidural steroid injections were a godsend to those individuals. So there's plenty of research actually higher than 75% of effectiveness, and if it can help you avoid surgery, that's great. Epidural injection does not fix the problem. So here's your spinal cord coming down, or the remnant of the spinal cord, and these are the nerve roots coming off at each level. So it'd be the L4 nerve root, the L5 nerve root, so forth. If you have a piece of disc coming out and pushing on a nerve root, that can cause the sciatica. That's where the steroid medication is injected. And that's called a transforaminal epidural steroid injection. Very common to do it that way. It's done as an outpatient in a surgery center or the office of a doctor who has an x-ray machine called a fluoroscopy, and it can work really well. Okay, it may need one injection, you may need two, or you may need a full series of 3 over a period of 3 to 6 weeks. And that can be repeated 2 or 3 times a year, the series, depending on the symptoms. So, if you can avoid surgery, great. Studies have shown that outcomes with surgery are really good as well, but they're equivalent to non-operative treatment with epidurals at the 1-year point. And if you can avoid surgery, you've avoided those risks of it. I mean, they're small, but they're real risks, okay? So if you can do that, that's the best course of action. Now, the question that our pain doctors get a lot is when you do the steroid injection into this area, does it do anything to that disc? Does it fix it? The answer is no, it doesn't. It is a proverbial Band-Aid, all right? The hope is that it takes care of the pain and your body takes away that piece of disc that's where it's not supposed to be. It knows it's not supposed to be there, so it oftentimes will disintegrate that little piece, okay? There you have it. There's plenty of information on our website and blog and our YouTube channel at preferredpaincenter.com. I'm Dr. David Greene. Your pain stops here.